Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Senese, enjoying this nice hot summer that we're getting this year. My wife keeps reminding me I did ask for it to get hot, so it's my fault if you don't like it. Hey, if you're watching us live, you'll be able to see us on YouTube, LinkedIn, Facebook, X, and Kick. If you're watching us on YouTube, hit that like button. I just took a course from YouTube, and they were saying that when you get people to like you, you get more viewers. Who knew? If this is your first time watching our show, be sure to check us out on uronurse.com. That's our website. You'll be able to find our other great podcasts along with our sponsors that you can visit their websites. And it's the best place to go to watch all 152 episodes that we've got. We've got a long backlog. Hey, we're coming up on our 3rd-year anniversary. And if you like to listen in your car, no problemo. We have this audio podcast. Every episode has an audio podcast that comes out about a half hour after the show on all your favorite podcasters. And I won't rattle them off. You can see them over there on the side. Hey, today I'm going to be talking about a subject called penis shrinkage. Is it science? Is it myth? Well, wait and find out. Hey, welcome, Lori. Welcome to the show. How's everything going?
Great.
I'll let you give a little introduction.
Hi, my name is Lori Atkinson. I'm a certified urology registered nurse. I have been in urology since 1998, and I am currently working at Northwestern Medicine in Geneva and Winfield, Illinois.
All right, good. And welcome to the show. It's always good to have an expert with us so that we can take any questions and answer them for if you guys have some. Feel free to put those into the comments. And hey, if you're watching, just want to throw a comment in there about where you're watching us from. That's always fun too. Now, in case you're new to the show and haven't been a long time listener, I am as I said, the host and producer of the show. I've been involved in urology for 40 years and just enjoyed it, but wanted to give back and kind of keep my hands fresh into urology. It gets in your blood, or I guess maybe your urine. So anyway, I decided to create UroNurse. It's been a big success, and I hope that you guys are enjoying it. You can put that in the comments too. Anyway, let's get on with the show. I'm going to take it away for you right now. So today we're diving into a topic that's often whispered about, but rarely discussed openly: penis shrinkage with age. Is it fact? Is it fiction? As men age, it's normal to notice changes in the body. But when those changes involve something as personal as the, penis, it can stir up a lot of concern and confusion. Today, I'm going to separate the myths from the medical facts and talk about what's really happening, why it happens, and what, if anything, we can do about it. So let's get started. Is penis shrinkage with age really a thing? What do you think? Well, when we talk about shrinkage, remember, we're not referring to temporary changes like cold or stress. We're talking about long-term anatomical changes with aging. So, is it fact? Is it fiction? Unfortunately, according to many of the studies I looked at, it's true. Some shrinkage can occur, especially after the age of 40. So let's talk about that evidence. I have a couple of studies that we're going to use to kind of talk this over. So first one is this Asian Journal of Andrology. Back in 2001, they did a study on the effects of the aging on the penile ultrastructure. So what'd they do? They got 17 male rats and they divided them into 3 groups based on their age. So group A consisted of our young rats, about 9 weeks of age. Now I think of these as like your gangsta rats. Their penile samples were obtained, not going to talk about how that was done, and observed under a scanning electron microscope. What were the results? The average thickness of the tunica albuginea was 0.14 millimeters. Now, group B, our middle-aged rats, about 14 weeks of age, those are the ones that move out and no longer live with their parents. The results, the average thickness of their tunica albuginea was, wait for it, 0.166 millimeters. Pretty much the same. Now, group C, those are our old rats, 62 weeks old. By the way, rats tend to live 1 to 2 years, so 62 weeks is pretty much an old timer. So what were the results for the old guys? The average thickness of their tunica albuginea was 0.06 millimeters. So 0.06 millimeters. In old rats, the tunica albuginea became thinner. With diminished elastic fibers, the collagen fibers of the corporal cavernosa were increased, while smooth muscle and elastic fibers were reduced. So how about decline in flaccid stretchability? It hurts to even talk about that. The length changes of the flaccid penis provoked by a maximum manual stretching of the glands was measured in 905 men. Where do they get 905 men to volunteer for this? In order to study its biomechanical qualities. Their study showed that the flaccid penis is deformable, extensible, and elastic in its longitudinal axis. Though with analysis of these variations of these biomechanical properties with aging shows a significant decrease. That's what we thought. Thus, the biomechanical behavior of the flaccid penis during stretching is highly different between young men and old men. 2 studies on post-prostatectomy shortening. So some people may experience mild to moderate shortening of their penis, especially after having a cancerous prostate gland surgery called radical prostatectomy, where they remove the whole prostate. According to a 2012 study, the mean average decrease in stretched penile length at 3 months after radical prostatectomy was around 1 centimeter. At 36 months, the decrease was 0.6 centimeters, and by 48 months, the mean decrease was 0.3 centimeters. So the study points out that the difference before and after surgery wasn't really considered significant. Erectile function helped restore penile length. So something with not getting those erections. Experts aren't sure why the penis shortens after prostatectomy, but according to a 2023 trusted source, some possible reasons for penile shortening include the following. They were robot-assisted radical prostatectomies, and they included people with high body mass index, heavier people, high prostate weights, bigger prostates, lack of nerve-sparing operations, which refers to saving the nerves at the site of the procedure. So in this rigorously conducted prospective study of stretched flaccid penile length, otherwise known as SFPL, changes after radical prostatectomy, there was evidence of loss at 2 months, but not at 6 months after radical prostatectomy. Confusing. I'm confused. Now, here's an interesting point. If you put them on PDE5 inhibitors, the Viagras, the sildenafils, all those, we found that it moderated the stretch loss with patients who regularly use PDE5 inhibitors, having no loss in their stretch length. So there is some surprising evidence out there, and it makes sense to get patients on these drugs earlier than later. Now, here's a study from Egypt. It found no significant correlation between aging and decreased penile length. However, men showed decreased testosterone. So we kind of know that with aging, testosterone can go down. We know both testosterone and dihydrotestosterone are necessary for normal penile growth. The penis tends to undergo an actual and irreversible reduction in size as men age. So the aim was to measure the stretched penile length. There we go, stretching that penis again. In aging males and correlate the results with the serum level of total testosterone. So 103 patients were recruited. Where they get these recruits, I'll never know. Then the length was measured, the stretch length, and serum was collected for testosterone measurement. So what were the results? It showed that the stretched length had a non-significant correlation with age, while serum testosterone showed significant decrease with age. So, what's the conclusion? Penile length does not decrease in males with aging, while serum levels of testosterone does. It's a little confusing now. Some of this information, we're saying it does shrink with age, and now we're saying maybe not. Testosterone goes down. So there might be other factors in play, which we're going to get to. So, as men get older, it's not uncommon to notice some changes down there, including a gradual decrease in penis size. True. This is usually due to a mix of natural aging and lifestyle habits. Oh, now there's one we haven't talked about. Now we know there's a drop in testosterone, but the studies are muddy at best to correlate with this. At the same time, reduced blood flow, often caused by conditions like high blood pressure or hardening of the arteries, can affect how well the penile tissues function, and appears in some cases scar tissues from things like Peyronie's disease, prostate surgery, past injuries can also cause the patient's penis to shorten or curve. Lifestyle choices such as smoking, poor diet, being overweight, who's that sound like? A bunch of Americans, right? Or not getting enough exercise. Well, now we definitely are covering a lot of Americans. Can speed up those changes by hurting circulation and hormone levels. Good news. Good news out there. Many of these factors can be managed with healthy habits and medical support. Now, on average, a man might lose about an inch or less over several decades, usually more noticeable in men with health issues. That's the key thing we're going to be looking at. So about an inch. Now, you may say, well, an inch is that terrible, but the average length of a man's erect penis is only between about 5 to 6 inches. I don't want to give up an inch. Lifestyle matters. Smoking and sedentary lifestyles can speed up the aging process and cause penis shrinkage like you see there. That's not really a penis either. It can be prevented. Good news. That's what we were talking about. Taking care of your health can make a real difference. The same advice that's good for your heart is good for your penis. So it's good for a lot of things. So we're going to talk about some of these things you can do. Now, if you're as old as I am, you probably remember smoking commercials back in the day. They were all the rage. They're, of course, banned now. But anyway, the Marlboro Man may have symbolized that rugged masculinity. But if he smoked as much as the ad suggested, his penis might be as short as a cigarette. So while the image was iconic, the reality is a lifetime of lighting up could leave more than just your lungs gasping for air. It could quietly shorten your manhood too. That's not on the box of cigarettes, is it? That label should be on that side, right? And why is this? So the chemicals in cigarettes damage blood vessels, reducing blood flow, which is essential for strong erections and keeping penile tissue healthy. Over time, this poor circulation can lead to loss of flexibility and strength in the penis, making it appear shorter both when it's soft and when it's erect. Smoking also speeds up a condition called arterial sclerosis, where the arteries narrow and harden, further blocking blood flow and leading to tissue loss. The good news? Quitting smoking can improve circulation, boost erection quality, and in some cases, even help regain a bit of lost length. Your body and your penis will thank you for it. So what about diet? Well, diet doesn't directly change the anatomical size of the penis. It plays a significant role in maintaining the health of the blood vessels, hormone levels, and overall circulation, which all affect penile function and appearance. A poor diet, like our American diets, saturated fats, processed foods, high sugars can lead to conditions like arterial sclerosis, which narrows the blood vessels like we talked about. Not just the heart, but the penis. Remember, those vessels in the heart are pretty large. They get narrowed. As they get to the penis, they get to be really small. And actually, one of the things that we look at with patients that come in with erectile dysfunction is their overall cardiac status. Because sometimes that can be the very, very first thing that kind of warns us that there's something going on. Could prevent a heart attack by looking at somebody who has problems with getting the erections. Now, this can cause erectile issues and give the appearance of reduced size over time. Additionally, obesity, often linked with a poor diet, can cause fat to accumulate around the pubic area. So sometimes what seems to be a shortening of the penis is a growing pubic area, virtually shortening the penis. In contrast, a heart-healthy diet rich in fruits, vegetables, lean proteins, whole grains, and healthy fats supports better circulation, hormone production, and vascular health, helping preserve both function and appearance of men in age. So when excess fat accumulates in the lower abdomen, kind of like this guy has, it can lead to the development of something called a pannus. It's like an apron-like fold of fatty tissue that hangs over the genital area. As I said, that fat pad can actually make it visually shorten the penis because it buries part of the shaft beneath the fat. So while the actual anatomical length of the penis remains unchanged, the visible length is reduced, which can impact self-esteem, sexual confidence, and hygiene. Several factors contribute to that accumulation. As we mentioned, our diet, obesity, lack of physical activity, poor habits, dietary habits, hormonal imbalances, aging, and decreased skin elasticity. So this condition, sometimes referred to as buried penis, in more severe cases, especially when the entire shaft becomes obscured. How many of those out you have had to try to catheterize one of these guys? You're like aiming for nothing. Treatment often involves weight loss, targeted exercise, or in advanced cases, surgical interventions such as a pennilectomy, removal of that excess skin. Now, have you ever heard this term, apple belly syndrome? I think that picture says it all. It's an informal term used to describe central obesity where the excess fat accumulates around the abdomen and waist rather than the hips or thighs. Now, people with this body shape are said to have an apple-shaped body as opposed to a pear-shaped one, which is what you'd rather have. Why does this matter? Well, apple belly syndrome is not just a cosmetic concern, it's a major red flag for health risk. You see someone who comes in with that shape, abdominal fat, particularly visceral fat that surrounds those internal organs, is associated with insulin-resistant type 2 diabetes, high blood pressure, elevated cholesterol, heart disease, increased risk of stroke, lower testosterone, and erectile dysfunction, and penile shrinkage. Did I get all my fingers in there? I tried to get them in there. Fun fact, excess visceral fat can also inhibit testosterone. What, you say? Exactly, because it promotes estrogen production in men, which may contribute to symptoms like fatigue, decreased libido, and changes in body composition. So when you see that apple-shaped guy, we have to understand that all that visceral fat's producing estrogens, which then compete with testosterone. Kind of a what came first, the horse or the, I don't know how that works. Anyway, you get the idea. So, diet. Now, as I said, we had a lot of great studies, but we're finding out sometimes we're our own worst enemy, right? So, when should you see a doctor? Well, if you should go to have somebody referred to, see us if they have sudden shrinkage, any sudden symptoms, pain, or other symptoms. They may be an underlying issue that needs medical attention. Now, while there's no magic pill, there are medical and therapeutic tools that can help restore confidence and function, as well as a healthier lifestyle. We're going to talk about some of these options that are available out there. Things like the vacuum device. A couple studies here supporting the use of vacuum devices, especially post-prostatectomy. VEDs are proven, non-invasive tools for preserving penile length and aiding erectile recovery, especially when started early after prostate surgery. They work by improving oxygen delivery, really important. It prevents tissue fibrosis and synergizing with medications like those PDE5 inhibitors I talked about. While ongoing research continues, current evidence supports the use of daily VED as an effective part of post-prostatectomy rehabilitation. Now, we had the guy who invented this on our show recently, the Restore X. It's a novel penile traction therapy device with randomized controlled data demonstrating improvements in penile length and erectile function after 30 to 90 minutes of daily use. This was done to treat something called Peyronie's disease, that curvature of the penis. Now, studies are looking to determine if similar improvements could be achieved post-prostatectomy. With the use of novel penile traction therapy device results in significant improvement in objective and subjective penile length post-prostatectomy and measures of erectile function, intercourse satisfaction, and overall sexual satisfaction. All right, again with our poor rats. Rats castrated 8 to 16 weeks showed reduction in penile length, girth, smooth muscle, and endothelial nitric oxide synthase, or ENOS, for being a lot easier to say. After 4 weeks of testosterone treatment, penile size and function were restored, confirming reversibility of androgen therapy. Another one for why we might want to treat people that have low testosterone. So key takeaways. I can't help but look at this poor guy over here holding those testicles. In adults with low testosterone, therapy improves erectile function and blood flow, but doesn't significantly increase penile length. We talked about those studies showing that. Animal models show that testosterone can reverse tissue loss and preserve penile structure, especially when the treatment is timely. Fibrosis reversal and structural preservation seen in the rats suggestion that testosterone might help prevent age or disease-related penile shortening. Now, here's another one I think is kind of interesting, something called penile dysmorphic disorder. It's a form of body dysmorphic disorder. A significant number of men worry about that their penis is too small, despite being within the normal anatomical ranges. So we're talking about a psychological issue here. A review in the British Journal of Urology, the BJUI 2015, found that the average erect penis length was 13.12 centimeters. That's like 5 inches. The average flaccid length was 9.16 centimeters, about 3.6 inches. Many men seeking penile lengthening procedures were actually within those normal size ranges. Some men experience penile dysphoric disorder, a form of, as I said, body dysmorphic disorder. These men may obsessively measure themselves. They got that ruler I showed earlier in the slide out all the time. Avoid sexual activity. Seek unnecessary surgical interventions. One study found that up to 25% of men seeking penile enlargement met the criteria for BDD. So counseling for body image is another big option. Although direct studies on penile shrinkage counseling are limited, the principles of sex therapy, cognitive behavior therapy, and multidisciplinary sexual rehabilitation are well supported. These approaches can help men reframe negative thoughts about their size or potency, address anxiety around performance and intimacy, improve quality of life even if physical changes are subtle. If shrinkage or personal concerns are impacting your patient's self-image or sexual life, talking with a urologist or sex therapist experienced in male body image issues can be highly beneficial. Combined medical and psychosocial approach tends to produce the best overall outcomes. So we talked about that cold reversible thing. Is it a myth? No. Yes, cold water or even stress can temporarily cause penis shrinkage. There was kind of a show out there a while back, and the guy was coming out of the pool and he didn't have a towel on or something and said, "It's shrinkage, it's shrinkage. I was in the pool." So it's true. It's totally normal, not permanent. Your body pulls blood away from the skin, including the penis, to keep vital organs warm or respond to stress. It's a short-term reaction that goes away quickly. It's very different from the slow-lasting changes that happen with aging and health conditions. So no, a cold shower won't shrink your penis forever. It's completely normal for men to feel vulnerable, exposed, or even ashamed during medical care, especially in situations involving genital exams. A man who believes his penis is smaller than the average may feel especially anxious or humiliated if he thinks the nurses or staff are judging him. So keep in mind these common emotional reactions to shame or embarrassment, worrying about being too small or not measuring up, fear that others are judging even if they're not, feeling stripped of privacy or masculinity, vulnerability during catheterization, surgeries, or physical exams. Many men tie their identity and self-worth to their genitals. Cultural myths about penis size equal masculinity. Porn and media exaggerate what's a normal man, and lack of open conversation about what's normal. So keep this in mind when you're examining male patients. That picture, I think, says it all. If that's the expression you get, you're going to be pretty nervous. So, bottom line, thank you all for joining me today for this important and often under-discussed topic of penile shrinkage, and while it might get a few chuckles in the break room, it's no joke to the men affected by it. So whether it's post-surgical, hormonal, lifestyle-related, or age-associated, penile length changes are real, and so is the psychological impact. As healthcare professionals, we have a vital role in normalizing these conversations, guiding men through evidence-based options like penile rehabilitation, hormone evaluation, smoking cessation, and vascular health strategies. And yes, let's remember that perception often overshoots measurement, with studies showing self-reported size is often an inch more optimistic than the ruler reveals. So let's continue being compassionate, curious, and a little courageous in talking about size. Not because it's everything, but because it's something that matters to our patients. Thanks again for your time and commitment to urologic care and for always showing up for these conversations, awkward or not. Now let's get to the questions. All right, Lori. You're in mute right now.
Sorry about that. So what I got out of that is because I don't have a penis, I can eat bad and not exercise. Is that correct?
There you go. And since I'm not a rat, I probably don't have to worry. It's really strange. Most of these studies were done on rats. Obviously, they're there to be able to measure. But it's I don't know if it's really clear evidence one way or the other, but there's a lot of factors out there, I think, that are causing this shrinkage. Now I'll ask you the question because I'm sure you get this one all the time. Have you, or I assume you do, have patients ever said to you, it's really been shrinking or noticed it or any of those complaints?
Well, absolutely 100%. They'll even ask me, am I normal? So, but I think, I don't think it happens very often, but this is what kind of struck me. My father had a prostatectomy, and I learned more about my father after he had his prostatectomy than I probably wanted to know. But that was definitely a question that he had. There are people that ask that question, especially after a prostatectomy.
Yeah. I found it a ton that, patients are going to, kind of, am I normal? Am I not normal? That they're always kind of questioning their size compared to other guys' size. Now, the other question I have for you, and I've run into this multiple times, is that fat layer that forms around the penis. And what they're calling shrinkage is really growth. It's growth of the fat around the penis. Have you ever had a situation where it was just almost impossible to catheterize somebody?
Yeah, absolutely. So I don't have as much of a, sorry, my cat's licking himself in the background. I don't any longer have a problem trying to get it. We call it the hidden penis, but when there's new nurses or medical assistants or who go in there and they're like, I can't find his penis. I'm like, you just got to go over there. You got to push around that fat. And then usually it's like a turtle, that head pops out as soon as, So, I kind of teach people, because the people that have never seen it before, it's not something that's really talked about, that they just think it's gone. They're like, he doesn't have one. Yes, he does. It's just deep down in there.
Yep. All right. And hey, if you're listening to the show and you want live and you want to ask questions, our comment box is open. I'm going to take that ticker off of here because it gets me going crazy. So yeah, I think that this thing, does obesity really make the penis appear smaller? To me, there's no question about it. It's just competing with what you have. So if you got a lot of fat around there, it's just going to bury your penis. And you made a good point, with how you sometimes have to push down on the fat layer to get the head of the penis to pop out so you can see it. I mean, this is where skill really comes in, or experience comes in, because when these patients all come into the office, they're very difficult to catheterize. And some people are just like hunting and missing, and it's embarrassing for the patient. So I think when you get somebody, with like your talent and my talent, it makes a huge difference.
It's even more difficult when they're not circumcised too. It's a little bit easier for people who are circumcised, but when they're not circumcised and they have the hidden penis, it can be quite challenging.
Another question that some of these I put together here. How does Peyronie's disease affect penile length and shape? Um, you want to take it, Lori? You've had some experience with Peyronie's?
Yeah, we have Pyrenees in our office. I'm not real educated as far as I haven't heard other than the fact, I mean, to men, I'm sure that if it was straight and not curved, it's going to look bigger.
Yeah.
I don't know as far as anatomically with Pyrenees whether it actually causes shrinkage. It just may be an effect, an illusion that they're looking at, that it looks shorter just because of the curvature. That's the only thing I can think of.
Yeah. Yeah. And I think some of that fibrosis does cause that, scarring down. Enough fibrosis will actually make it look smaller, non-erect. Of course, when it's erect, it's going to be pulling to the side and having that curve. And, that's where I was talking about that RestoreX device, where it can actually, by stretching, can kind of improve that. Now, here's another one that I get a lot from patients that have had post-prostatectomy. They come in and they say, my penis is shrunk. And I used to think that was just BS. Penises don't shrink just because you had an operation, or the amount of urethra that they're taking away shouldn't really reduce the size of their penis. But there's a lot of studies out there that show that now, that there is definitely shrinkage after prostatectomy.
Yeah, a lot of times I didn't believe it until my own father, and nobody had discussed this with them, and he's the one who said, "Hey, do you have shrinkage afterwards?" And I'm like, "Oh, then it could be true." So
Yeah, yeah, no, most definitely. Um, and that had that slide come up. Is it reversible? And it is. Things like that RestoreX will help to reverse it. One of the biggest things, and we found that trying to get patients to utilize PDE5 inhibitors right away, get them on Viagra, sildenafil, any of those drugs, will help to prevent that or reverse that. So once they start getting erections, that's one of the big issues that causes a lot of this shortening.
yeah, they should be doing both the vacuum erection device and the PD5
Yeah,
inhibitor. So, yeah.
yeah. Take that one off here. Can erectile dysfunction contribute to the perception of a smaller penis? Uh, I don't know that it's going to make the penis look smaller if you have erectile dysfunction, but it's going to help contribute to that. That's for sure. Because one of the studies with the testosterone drop is that the penis will start to shrink, especially because you're not getting those erections. The protection effect of having the erections every night for a man is what keeps kind of things going forever.
So I have a question for you, Vic. You mentioned
Yeah.
the testosterone, obviously lowering as you age. Did you ever see in your practice patients come in and say, "Hey, my penis is smaller. Can I get my testosterone checked?"
Yeah, yeah, and they should. The interesting thing, there's a study out there right now, and I can't remember the exact figures, so don't quote me on it, but they're showing that our 40-year-olds right now have testosterone levels equivalent to our 65-year-olds of my age. That our younger men are having much lower testosterone, and that's causing a lot of these issues. So, and they're not sure, is it, part of it, the belly fat, as I talked about, that apple belly syndrome, where all that belly produces estrogens competing with testosterone, or is it all the plastic bottles that we're drinking our water out of that have these plastic estrogens in them that we're consuming? So I don't know, but I think there's something to it. What's that song? There must be something in the water.
Yeah.
I think it's true. All right. Well, we don't have too many people putting any comments in, so we're going to run out of questions, which is fine. I thought this was an interesting topic. I don't think it's something that we cover very often, so I like to try to look for new things. So if you ever have a question or something pops up into your head, hey, go to the website and send it to me. That's a lot of times why we get some of these subjects to talk about. Just take a quick look here. I did get Diane saying, great presentation with a lighthearted approach. You almost have to be lighthearted on this subject. And I think that one of the things I did want to stress is it's, being a man, we're pretty fragile when we're having female caregivers taking care of us. It's just like always in the back of your head, like, is she going to think I'm abnormal? Or, you worry about, would you get an accidental erection? I've had that happen a few times as because some erections can be caused just by touches. Somebody will get an erection while you're trying to catheterize them. And again, these are embarrassing moments for them. So, and I'm maybe even for us. So keep that in mind. All right. Let me go over to our intro for next week.
Are you up to date on the latest STI guidance? Sexually transmitted infections. Essential Knowledge for Healthcare Workers is a 2.75 contact hour educational series designed to keep clinicians informed, confident, and capable when caring for patients with or at risk for STIs. Presented over 3 weekly modules, this professional development program is hosted by Vic Senese, and expertly presented by Kirsten Trudeau, a respected family nurse practitioner and STI educator. Whether you're a nurse practitioner, PA, physician, or student, this in-depth series will walk you through epidemiology and trends in STI transmission, current CDC screening and treatment recommendations, clinical pearls for patient communication, diagnosis and prevention, special populations and practice updates. Join us on the next 3 weeks starting July 5th at 9 a.m. Central Time to learn more.
Yeah, so we're going to do that for the next 3 weeks. So join us. It's broken down into 3 separate modules. They're a little less than an hour a piece. The last one's probably the shortest of the group, but it's good for almost 3 contact hours, which is pretty nice. And I think it's really a good. I was glancing through it. It's a good breakdown of how to identify, how to treat these sexually transmittable diseases, and something that we all encounter in our practice. And it's a changing environment too. So join us for the next 3 weeks. And we're going to do those live. We'll have of course, those will be recorded when she's talking, but then we'll come back on. So we'll take questions in case we can answer any of those for you. Otherwise, hey, always keep watching UroNurse. We're with you every Saturday morning at 9 a.m. Central Time. Most of the time, always me. Most of the time with Lori. So we always appreciate having Lori's help here. All right. Any last words, Lori, for us today, Lori?
Yeah, it was a great presentation, something that's brought up that people don't talk about. And I think those are the best ones to get out there. So great job. Glad to be here.
Thanks. Hey, everybody, go out there and have some fun in the sun.